a new virtual hospital is being launched by the government in an attempt to modernise the NHS and tackle very long waiting lists. It would mean that checkups and follow-ups were all done online, and even some assessments and appointments would be online too. The Health Secretary hopes that the plan would free up doctors for those patients who still want to be seen face-to-face. But do you think all appointments really ought to be in person? Maybe you'd be left out of anything online because you're not really online yet, so you're never really going to get the hang of how to work it. Or do you feel that going online could help save the NHS? Cherry, what do you think about
I'm
this?
such a big fan of this. We need to bring the NHS into the 21st century. I think it's going to happen eventually. Let's get on it. Some waiting lists are so long, gynecological waiting lists are so long. For a woman waiting, it can be life or death. Getting a GP appointment is really hard. I have a podcast called No Appointment Necessary with Dr. Amir Khan, who's a practicing GP, who absolutely understands that so many people can't get to their GPs. They actually stop trying. And also to find an appointment is really difficult. You know, you've got to plan in advance with work. How do you know when you're going to get sick? It's incredibly difficult. It's shenanigans to get an appointment. So either people go to Google or they go to TikTok. They get misinformation. It's very difficult to get the right information. So online, quick call, quick video call, done and dusted.
But Jerry, you've just said it's very, very hard, particularly with gynecological issues. How can you do that virtually? I mean, isn't that the kind of thing where there has to be an actual doctor looking at your actual bits, you know, taking an actual smear? You can't just describe your... I mean, how is that even going to work?
I think maybe you can. So, for example, some of the gynecological cancers have very specific symptoms. So, vulvar cancer has, you know, a change in skin tone and a rash. And if you were worried about something, let's say I woke up tomorrow and I've got something's wrong, and I've got an online appointment which I can do tomorrow afternoon. I'm at work and I just nip out 2 minutes and I can say, doctor says, absolutely, that's concerning. Come in and see me, or I'm going to send you straight to a consultant. Some women are having to wait 2 years to see a consultant because they either can't get to their GP or their GP. And a lot of women especially women, are fobbed off, and unfortunately that is a real problem we have at the moment. They get said, intermittent bleeding isn't a problem, just go home, have a hot bath, and it is a problem. So online would also get rid of that waiting list we've had from COVID, which is bad.
Let's bring Pat Sharp into this. What do you think? Do you think this is worrying? Do you think it excludes lots of people who are not online literate? And that all pretty much includes me. I mean, I would be very wary of just plunging online. And also, we're all used to these Zooms and, looking at people down the line. You can barely see them. You're always squinting at the thing saying, hang on, wait a minute. So you bring it up a bit. Can't you put a light on? We can't really see you. Imagine you're trying to show your intimate places to a doctor down the line. How's that going to work, Pat?
I think if you're online literate, it's very difficult if you're perhaps elderly and you don't know how to do a Zoom or whatever, but you'd rather do a phone call, because then a phone call isn't going to give you the full details, because you're not able to obviously show. You can only describe. So I think they do need to be virtual. You do need to have a camera of some kind to at least get, as Sherry says, the initial sort of observation to then maybe get an appointment follow-up.
But would you be happy to do that?
Yeah, I think I would. Yeah,
you think that's okay?
Yeah, I'd be fine with either. I mean, a phone call or I think for everybody, if they could get a video call, it would be better. But a lot of people perhaps won't be able to go down that route. Perhaps
okay, Claire, this is a bit Dr. Finley's casebook of me, but that is my vintage. Does everyone remember Dr. Finley?
Yeah.
Yes. Gosh. And, the idea was your doctor... I know this sounds like the old-fashioned days, and I know I sound like...
But it's important, Vanessa.
Your doctor, was meant to know you.
And your family.
Know you. So
That's
if you walked in and
community.
said, Doctor, I've got a bad knee, he could, or she, could look at you and say, now, look, you don't look right. I'm not sure it's your knee. Are you okay?
Yeah.
Have you got over losing your mum?
Yep.
Are you, is it because you're still not pregnant and you're having fertility treatment? What is the reason that you don't really seem to be yourself, Claire? And then you would be able to say to the doctor, well, I know I said it was a knee, but actually I'm feeling desperately worried about something.
Yeah.
I mean, I know that sounds like a kind of Hallmark movie, but honestly, it used to be true, didn't it?
It used to be true, and that's exactly the route that I think we should get back to. Community nurses, community midwives, community doctors, general practice. It's general because its point is joining up the dots on how you're presenting, your living conditions, your environment that you're living in. It all marks the person, and we wonder why. mental health issues for young
Exactly.
people. You know, people don't get out. They don't feel that 10 minutes down the line is enough, and it's not. And it also feels that people are turning to Dr. Google. They are getting their own symptoms. So when they're presented with that phone call, Pat, they're then able to, you know, come out with a diatribe of X, Y, and Z symptoms. And the doctor's at the other end of the phone thinking, yeah, it's that, ticks that box, tick that. Okay, your prescription's been sent to your pharmacy, go and pick it up. Instead of greeting from the waiting room.
That would be better.
What's the patient's gait like? How are they presenting today? Oh,
nice.
yeah, remember.
Right.
That is true.
Unsurprisingly, the lines have lit up. So we'll go to the calls. But I just say my doctor used to be called Dr. Parkinson, and he was married to Dr. Gibson, and they had this practice, and you would see them all around. You'd see them at the greengrocer. You'd see them, you know, when you went to Brownies. They were just around.
Yeah.
So they were part of your real life. It wasn't pretend.
Yes.
So they really could see if you weren't looking quite right or not. They knew your family. It was a whole different ballgame. And this was in London. I wasn't growing up in some small village. When I describe my childhood, it sounds like it was some rustic village. It wasn't at all. London N20, that's where I grew up, in London. Right, let's go to Jenny in Suffolk. Jenny, what do you think about this? More online medical care of all different kinds?
Well, Vanessa, you will think this is a joke, but it is not. I have been referred for an echocardiogram, which is a bit like an ultrasound, looks at the structure of your heart, which, by the way, is done by a technician. So it's not that it's even taking up a doctor's time.
Right.
Anyway, my GP phoned me to say, I must say she sounded a bit sheepish. She said she'd had a call from that department saying, would I be able to buy a device from Amazon that costs £100, do a reading and send it on an app? Well, I just burst out laughing, and so did she. And I said, are you joking?
Yeah.
She said, no. She said, I must say, I'm a bit surprised. And I said, well, I'm a bit like you, Vanessa. I'm not computer literate. I've got a flip phone. I don't do anything like that.
Yeah.
So I said, there's no possibility that I'll be doing any of that.
No.
And obviously they are arranging for me to go to the hospital and have it, but I couldn't believe it. So if this is a sign of things to come, well, we'll be being sent surgical instruments next to our own
She's
operation.
not wrong. You're not wrong. Actually, a bit of DIY medicine. We'll send you some pliers to pull your own teeth out. It'd be absolutely tremendous. Jenny, honestly, thank you so much for the call. Let's go to Jazz in London. Jazz, do you like the sound of this? Much more online. I think they're even calling it online NHS or something, some kind of online hospital, really.
Hello, Vanessa.
Hi.
No, I don't. It worries me.
Yeah.
Because I just feel like we're not numbers and they'll be just rushing it. For example, I went to the hospital the other day and I had to go for an ultrasound and a CT scan. And then the doctor said, oh, while she's here, you might have to do her mammogram, which is in 2 months' time. And I thought, they're just rushing it. I'm not just a number, and the mammogram I had to keep going in for. It was very painful. But I just worry about the people that are older than me. I'm not illiterate. My computer skills, sometimes I would question.
Right.
I don't get it. And then one of the kids maybe have to help me. But if there's older people than me, they may well feel dissociated and not want to use their AI or whatever it is they're offering. Sometimes we just need a doctor to just listen and then give us that support.
Couldn't agree with you more. Agree with everything except maybe the bit about the mammogram, because to me it seems like, we're always saying, why isn't the NHS more efficient? Why aren't they more efficient?
Yeah.
And for somebody to saying, Jazz is there, right, she's going to need a mammogram, let's do it now while she's here, saves you coming back, saves another appointment. Yeah. I'm very sorry it was painful though, because I had one done live on telly, because I think if they're, carefully done, it's a bit squashy, but a bit squeezy, but it doesn't actually hurt. So I'm sorry yours hurt, but it's a great thing that you had it done. And thank you so much for calling. Let's go to Ray in Kent. Ray, do you worry about this? Much more medical care online?
Yeah, definitely, because I'm a senior citizen.
Yeah.
I haven't got a computer. Mm-hmm. I've got a mobile phone. And I'm one of those that built the National Health to what it is or was 20 years ago. Uh-huh. And it seems all of a sudden that some genius has come along and said, wow, what we're going to do is we're going to put it online, without any respect for the people that actually made it what it was and can't use a mobile phone or haven't got a computer.
Yeah.
And you know what, love? Have you ever tried to get in touch with a doctor nowadays? Have you ever tried to get in touch with a doctor? It is
Total
virtually...
nightmare.
But I feel, Ray, like by having online appointments, that will free up so much time. So the people who can't use the internet, don't want to use the internet, they'll have more space to sit and time to see the doctor. The GP doesn't. I don't need to see the GP. If I've got a UTI, which I have all the time, I just need to say, these are my symptoms. I know what it feels like. Please, can I have antibiotics? That's a 2-minute phone call rather than me taking up all his time having to travel there. So that someone like you's got more opportunity to see him. I think that get rid of lots of appointments that are unnecessary and free up lots of space for people who really need it.
I just keep thinking, how many doctor's appointments do they not need to actually be able to see you? Like, I've got a sore throat. You've got to look down my throat, haven't you, to see whether you've got pus on your adenoids, your tonsils, or whether it's fine, it's just a virus and they can't give you anything anyway. Do they need to actually physically look at you and make you say R and 99 and open your mouth and all that? Do they need that for virtually everything, really?
I don't think so. I think that lots of things, if you're describing your symptoms, and maybe it's something that's recurring, so you understand what it feels like, that is a 2-minute phone call. He can give you what you need and you'll be on your way.
Isn't one of the issues, though, here, Pat? You might not know they are symptoms, or you might not know they're relevant. You might have a feeling somewhere in your body, but you don't associate that with whatever it is you think is the matter, so you describe it, but you're not a doctor. So you don't describe it correctly. Well, and how are you meant to, anyway?
Well, if you have an opportunity to at least reach a doctor in some shape or form by either a phone call or a video call, and then you feel that you've got a chance, rather than waiting 2 weeks to get an appointment, surely it's got to be better than just waiting for the appointment.
But is it a way of just making it not really very good, but making that seem acceptable?
No, because there's both available, aren't there? You can still go and see a doctor. This isn't the only hospital. They're not taking it online for everyone, are they? It's available as an alternative and a starting point.
Let's go to unless they make it more and more that and less the other thing, which is almost inevitable. Let's go to Amy in Carlisle. Hi, Amy. What do you think about this one?
Hi, Vanessa.
Hi.
I don't think it should all be online, but I definitely think more could go online or by telephone. Now, I live in Carlisle. On your show a few weeks back, you were doing the 10 worst NHSs in the country, and we were 9.
Yes.
Now, I'm having problems with my hands at the minute. I had a doctor's appointment yesterday morning, and she said, really, before we go any further, we need to get them x-rayed.
Right.
So now I think she could have done that over the phone or through some sort of online consultation-y thing like you're talking about.
Right.
And then for the 9th worst NHS in the country, I saw her at 9 o'clock yesterday morning. I've had a letter come in this morning's post. My x-rays are next Thursday.
That's amazing.
OK, so what do you think about that as a level of service?
I don't think you could beat it.
Pretty good, isn't it?
I don't think even in private healthcare you could beat that.
Absolutely. How are your hands right now?
Hurting.
What do you think is the matter with them? What is it, do you think?
I don't know. I'm disabled with my back and my hips at the minute. I've been off work 14 months.
Oh, you poor thing.
And I don't know whether it's just using my hands differently. I've got a lump on one of my knuckles.
Oh, you poor thing. Sorry to hear it, Amy.
I could, the same as I'm explaining to you, I could have explained to her and she could have said, right, before we go any further, we'll get them x-rayed and then come in and see me.
OK, totally valid point, I think. Excellent call. OK, that's a very good case for doing it, isn't it? Very good case, Amy. Thank you. Wish you well. Let's go to Sean in London. Oh, Sean, you're on the same page as I am with this one. Sean, the days of Dr. Finlay and his casebook, Marcus Welby, MD. Do you remember that? We used to watch James Brolin's married to Barbara Streisand now. Who knew he'd going to live happily ever after like that? Love those shows about doctors, Sean.
Absolutely. And I remember my family doctor who could speak to all of my family and knew us very well. Now, when I see a doctor, I don't quite know who I'm going to see at any given time. And I think to one of the points that the panelists make, I think we need to tackle why we've got a backlog from COVID. And it's because people are cancelling at last minute as well. So the appointments become unavailable. So maybe we should put a cap or maybe say, let's put a charge for people who do cancel. But I think talking to a doctor is very good for your mental well-being as well. And you can ask the relevant questions while you're face-to-face. And with my practice, it's a catch-22 wherever you are, whatever postcode. But I'm very lucky that if I call before a certain time in the morning, before they're released, I will be able to get an appointment pretty much the same day.
Oh, you are lucky. Don't tell anyone where you are. Just keep it completely stum. Otherwise, you know what's going to happen. Shh, don't breathe a word about it. What do you think of this idea, Pat, of Sean's idea of charging people who cancel appointments or don't show up?
Yeah, we've heard about it in the past, and they've talked about it, but they haven't implemented it yet, I don't think. But anyone who lets even a hairdresser down should be in trouble. So if you're going to let a doctor down, it's crazy. You've got to go to your appointment.
Do you think so? We don't pay, so we don't value, Claire?
I don't think it's a case of that. I think people, maybe because they wait so long for the appointment, actually feel better. So therefore they think, well, I don't actually need to turn up.
Phone up and cancel it.
But yeah, no, I agree. If you can get through, that's the other problem. But sorry, I think we're missing a point here as well. Doctors are patients. And I think it's important for doctors to have that human interaction too.
With each other,
with each other and with their patients, because they can learn so much.
I think that my grandfather was a GP in a village in Suffolk, and he knew absolutely everyone. And there's a gate in the church that's still dedicated to him, and he knew everyone. And my mum said that if someone missed an appointment, he could just go and knock on their door because he would know. But everyone lived a 2-minute walk away. And the problem is we're so dispersed now, and the boroughs cater to so many people, so transient. People are constantly moving. That whilst it's such a lovely idea, and my grandfather used to say that during the full moon, he used to say everyone used to get up to all sorts, and people used to strip naked and run in the on the fields. So it's like he knew everyone. He knew who was going to strip naked during the full moon, and but it's just too much for GPs to cope.
Isn't it so sad? Such a sad indictment that your pet is better looked after in terms of getting appointments than us humans.